This is Glaiza, and as beautiful as her smile actually is, she's actually experiencing pain on her jaw, or what we call TMD, or temporomandibular joint disorder. She sent me a message asking for my help on what I can do for her jaw pain. As she was feeling clicking and popping sensations or sounds on her jaw, she can't open her mouth fully. She's feeling pain, tenderness, and numbness on her jaw joint, plus some tension headaches at the back of her skull. And what I'm about to show you right now is her journey from this to this. Glaiza started messaging me 2 or 3 weeks after she started feeling pain and discomfort in her jaw. She looked up online, asked a lot of friends, seek out help from a medical professional, a dentist, but unfortunately, she can't find anything of help. So, upon browsing online, she came across me and then started messaging me, and we started communicating on a much more daily basis. So, it's around pandemic time when she messaged. It's about 5 or 6 months ago from now. And I thought to myself that I have enough time. I'm not doing that much and I still really wanted to help. So I asked her if she have the time to do an online consult. We scheduled it and then we started our first online session. Before I proceed with what happened to our session, let me just explain first 2 important points that I think is really gonna help you decide on the management and treatment for your TMD. So number 1, it's really important to have a multidisciplinary approach with regards to management of TMD, or temporomandibular joint disorders. What I mean by multidisciplinary approach is that you need a team with different expertise who's gonna manage your pain. So you're in the center of that team, and then these guys who are expert with the dental care, physiotherapy, otolaryngeo therapy or prescription, maxillofacial experts. These are the guys you need to help you manage your pain and discomfort. So most of the cases with TMD, it's really complex. It can come from a lot of different things. For example, degenerative changes on your jaw. It could be from a simple muscular imbalance around the muscles acting on the jaw and neck, or it could also be from a dental malocclusion. So what I'm saying is, it's really important for you also to get a referral from a dentist, maxillofacial expert, otolaryngeal expert, physiotherapy, and a doctor, plus you, to help you manage your pain and discomfort. The second point I wanted to make is for us to subscribe first to those treatments that are reversible in nature. So what I mean by that are the treatments that are conservative in nature. So we don't want to subscribe to treatments, especially at first, that will make permanent changes on our body or permanent changes on our joint. So specifically surgery or bracing to correct dental malocclusion. So we wanted to do splints first before subscribing to bracing, or we wanted to do physiotherapy first before taking on surgical measures. Why? Because most of the time, most of the cases, TMD can be managed conservatively, but there are some cases wherein you really need to do surgery or you really need to do bracing to manage your pain. Okay guys, so now let's get back to our session with Glaiza. So Glaiza is very cooperative with regards to the management and treatment of her jaw. She really wants to be better. So at first, what we did are some assessments. So number 1 thing that I would like to check, especially in terms of joint pain, is what's the resting position of the jaw in space. So I asked her to send me photos of the posture of her face and her jaw in a resting position. So I asked her to take photos, front view, side view, left and right, for me to see what's the resting position of the jaw. Second assessment I did is I checked how much mouth opening can she do. So ideally, we have to be able to open our mouth without pain and discomfort while inserting 3 finger breaths inside our mouth. So at first, she can only put 1 finger because having 2 fingers inside creates a lot of pain and discomfort already. Plus, she feels that her jaw might lock if she tries to open up much more. So that's the second thing that we would look at. So apparently, she only has a very small amount of mouth opening. But later on, we'll see if she improved after doing the physiotherapy exercises. And then the last point or the last test that I did is I check how her jaw is moving when she tries to open and close her mouth. So I just ask her to open, mouth opening, and then closing of the mouth, and then see whether the jaw deviates from the left or deviates towards the right side when she tries to open her mouth. So those are my assessments, and those are the things that we wanted to help her with, because those are the 3 main cardinal problems with regards to TMJ or TMD. So as soon as I got all the information that I need, we started doing the physiotherapy session or the treatment. So 3 principles that I follow with regards to treating jaw joint pain or TMD is number 1, we have to work first with the alignment of the jaw, because the better the alignment of the jaw, the better mouth opening we get. Second thing is we have to teach that jaw joint how to move properly, because oftentimes when it deviates to one side, we tend to experience that click and locking sensation. So it's really important for us to train the jaw joint and the muscles around the jaw how to move properly. And then one last thing is to strengthen the muscles all around the jaw to improve its overall function. Okay, so Glaiza and I started our session by doing some soft tissue work on the muscles around the jaw and the neck. So oftentimes these 2 muscles, the temporalis and the masseter, are the ones that are being tight or stiff, increased in tension. And the muscle here behind our neck, which is your suboccipital muscles, these 3 muscles are the ones that are often stiff and tight, and we need to make sure these muscles are relaxed first before we do some alignment or movement exercises. So very simple, we started first with the masseter. So locating this part, and then we do it on both sides. So I just ask her to pull up the tissue, and as she pulls up the tissue, I ask her to open her jaw. And then do 2 to 3 passes of that. So it's really important to be careful while doing these exercises. We don't want to push through pain. We wanted to create an environment wherein the jaw is much more relaxed. And by doing this exercise or soft tissue treatment, it will help us later by with the exercises that we're going to do. So same thing with the temporalis. So we locate that muscle over here. We pull the tissue up and back as we try to slowly open the mouth. Not forcing it through pain. And then the last thing is the suboccipital muscles. So we will hook these 2 thumbs behind our skull right over here. And then as we move, we're going to tuck our chin back. So we're pulling the tissue apart while tucking the chin back. So once we get to that, we started doing the alignment exercises. So oftentimes with TMD, the joint is shifted towards one side. It's either left or right. So what we want to do is try to put it back to center. So if your jaw is deviated towards this side, so we wanted to place one hand here and then the other hand here, and then try to push the jaw towards this way and that way. And then try to open up the mouth. So I made a video about this on how to troubleshoot your jaw joint pain, so feel free to check that out in the video section of my YouTube page. After working with the alignment exercises, we started to do some movement exercises for the jaw. So I taught her the simplest one. So I asked her to place both fingers here on her jaw joint. And then I asked her to place her tongue on the roof of her mouth. And then from there, I asked her to just practice opening the mouth in front of the mirror. So placing two hands here, tongue, the roof of the mouth, and then opening of the mouth. As she do this exercise, she just needs to make sure these two joints over here are moving synchronously as the jaw joint opens up, and the chin right over here stays in midline when she tries to open up the mouth. So I asked her to do those two exercises first and then play with it for a week or two and then get back to me with the results. Okay, so after doing alignment exercises and movement exercises for the jaw, so she did those exercises for 2 weeks, and then she contacted me again and then told me that her mouth opening definitely improved. So she can now open her mouth fully without experiencing sharp pain and discomfort in her jaw. The only problem or the only struggle she has is whenever she tries to open up her mouth, she feels still that the jaw is going to lock, and she still feels that grinding sensation whenever she initiates that mouth opening. So I told her and I gave her new exercises for the jaw, specifically strengthening exercises, because she can now open her mouth fully and she's now training her jaw joint how to move properly. So I gave her a few strengthening exercises she can specifically do at home. So mainly one for the mouth opening. So we're trying to push the mouth upward while she tries to resist my force by opening the mouth. She also do pushing towards this way and then resisting going this way. Also the other way around. And one last is we're hooking our hands again here on the angle of the jaw. And then we're trying to push a little bit forward as we resist moving back. So I gave her those new exercises and I told her to try it for a couple of weeks and then get back to me again. Now, after consistently doing the exercises for her jaw, specifically the alignment exercise, the movement exercise, and now the strengthening exercise, she did it consistently for 3 months. And right now, here's the results. Okay, so now as you can see here in the photo, her jaw alignment is way better compared to the 3-month version. So it's not that shifted now on one side, and she now reports that she doesn't feel any grinding sensation or locking sensation on her jaw when she tries to open her mouth. Of course, she can now open her mouth fully, and then the movement of a jaw is more centered compared to the previous one when she tried to open the mouth. Okay, so Glaiza is very happy and very thankful for the exercises that I gave her. She's now fully recovered and she doesn't experience pain, locking sensation, headaches, numb sensation on the jaw. So it's really a process of recovery. It's not always a smooth one, a smooth path of recovery. Sometimes it has ups and downs. But if you stay consistent with your treatment, you can definitely get better, especially if you have a specific goal in mind and you have a team around you supporting you for you to achieve your pain-free life. So I'm here to show you guys that there's always hope with regards to the pain that you're experiencing. You just need to find out those people, that team that will help you achieve your maximum potential and function. Okay, so now let's go with the questions. So here are the most common questions Glaiza asked me during our session. So I always tell my patients that the best sleeping position is the one you're most comfortable with. But with regards to those people who are experiencing TMD, the best position would be a supine position wherein you're lying on your back facing up on the ceiling. Why? Because your jaw joint or the muscles around your jaw are much more relaxed when you're lying flat on your back facing up compared to when you're sleeping on your side or when you're sleeping face down. In terms of food, it is advisable for you to consume foods that are soft foods in nature compared to those food that are really hard to bite. So it creates much more tension on your jaw when you're eating those hard stuff. So highly recommended for you to switch on a soft food diet while you're still experiencing TMD. It's also found out that foods that are high in acidity can cause more pain on your jaw. So as much as possible, we try to avoid also those types of food. So it's not common to experience tension headache when you're experiencing TMD. So what you can do for you to manage your tension headache is for you to create space and decrease the tension on the muscle here behind your back. So I would greatly recommend you to place one hand here above the skull and then the other hand on your chin. And then you just try to push the chin back, creating a stretch onto the back muscles. So numbness on this part of the jaw can come from two factors. One, from dental malocclusion or dental issues. Or two, it can come from the muscle on your neck, which we call the SCM or the muscle here. So if it's a dental cause or if it's coming from your tooth, it's highly recommend for you to see a dentist for them to give you the proper treatment and much more precise treatment for that numbness that you feel here. But if it's a muscular in nature, what you can do is create space also here on the muscle of your neck. So if your neck's too forward, the muscles here tend to get stiff or tight also. So what we need to do is stretch those muscles. And once we create good length onto these muscles, it should improve the numbness that you feel here. So best way for you to do that is to create a stretch here. So you're just bending your neck backward, looking up the ceiling, and then turning towards the side you wanted to stretch. And then also do it on the other side. So looking up, bending away from it, and then looking towards that side you want to stretch, and then pull your head back even more. So that's a very good way to stretch and create length on the SCM muscle. After you try stretching it, try to feel if the numbness on your jaw decreases. So that's it, everyone. If you have any questions, I would like to engage with you guys. So please comment down below your questions and I'll be happy to answer those for you. See you guys.